In the autumn of 1937, across the American South and beyond, parents began giving their sick children a new medicine. It was a sweet, pleasant-tasting liquid, flavored with raspberry, easy to swallow, exactly the kind of thing a child would take without a fuss. It was prescribed for ordinary illnesses, sore throats, infections, the kinds of things children get every year. The parents had every reason to trust it. It contained a genuine miracle drug, one of the first medicines in human history that could actually cure deadly bacterial infections. They were giving their children the cutting edge of modern medicine. What they did not know, what no one had bothered to find out, was that the sweet liquid the miracle drug was dissolved in was a poison. A chemical cousin of antifreeze, and over the following weeks, more than 100 people, many of them children, would die slow, agonizing deaths from the very medicine meant to make them well. This is Dark Diagnosis Files, and this is the story of the Elixir Sulfanilamide disaster. Everything in this account is drawn from documented history, from the archives of the US Food and Drug Administration, and from detailed historical records of one of the deadliest medication disasters in American history. To understand how it happened, you first have to understand the drug at the center of it, and why it seemed like such a gift. The drug was called sulfanilamide, and in the mid-1930s it was nothing short of revolutionary. This was the era just before antibiotics as we know them. Before this, a simple bacterial infection, strep throat, a wound infection, pneumonia, could and routinely did kill people. There was very little doctors could do to stop an infection once it took hold. Sulfanilamide was one of the first of the so-called sulfur drugs, and it could actually kill the bacteria causing many of these infections. It genuinely saved lives. It was, for its moment, a wonder drug. Sulfanilamide had been used safely for some time in powder and tablet form, but a pharmaceutical company in Tennessee saw an opportunity. There was demand, particularly for treating children, for a liquid version, something easier to swallow than pills. So the company's chief chemist set out to create one. It's worth understanding just how much excitement surrounded sulfur drugs at that moment, because it explains the rush. These medicines were making headlines around the world. In one famous case, the son of the American president had been successfully treated with a sulfur drug for a serious infection, and newspapers celebrated it. Doctors who had spent their careers watching helplessly as patients died of infections they could not touch suddenly had a weapon that worked. Demand was enormous and growing. A company that could offer sulfanilamide in a new, more convenient form stood to profit handsomely. Speed to market mattered, and in that climate of enthusiasm and commercial opportunity, the careful, unglamorous question of safety was simply never asked. And here is where the disaster was born, out of a simple, catastrophic problem of chemistry. Sulfanilamide does not dissolve easily in water or in alcohol. The chemist needed to find a solvent, a liquid in which the drug would dissolve, so he could make his sweet elixir. He experimented, and he found one that worked beautifully, a chemical called diethylene glycol. The sulfanilamide dissolved in it perfectly. The chemist then added raspberry flavoring and other agents to make it palatable, and the result was a clear, sweet, pleasant liquid. It looked good. It tasted good. The drug was evenly dissolved. From a pure formulation standpoint, it seemed like a success. There was just one problem, and it was the only problem that mattered. Diethylene glycol is toxic to humans. It is a chemical related to the family of compounds used in antifreeze, and when ingested, it attacks the body, particularly the kidneys, causing them to shut down and fail. Now here is the single most important fact in this entire story, the fact that transforms it from an accident into a preventable tragedy. Nobody tested it for safety, not on animals, not on anything. The company checked the elixir for appearance, for flavor, and for fragrance. It confirmed the mixture looked and tasted good, but it performed no test whatsoever to determine whether the product was safe to swallow. And astonishingly, at the time, this was completely legal. Under the food and drug laws that existed in 1937, there was no requirement, none, that a new drug be proven safe before it was sold to the public. A company could formulate a medicine and ship it and put it into the mouths of children without ever once checking whether it would kill them. The chemist, it seems, simply did not know that diethylene glycol was dangerous, and because the law required no testing, nothing in the process forced anyone to find out. In September 1937, the company shipped hundreds of gallons of Elixir Sulfanilamide across the country to pharmacies and doctors in numerous states, ready to be prescribed. An amber glass bottle on a wooden shelf, a faded handwritten label, sweet red liquid catching the dim light. The deaths began within weeks. The first alarm was raised in Tulsa, Oklahoma, where a cluster of patients died after taking the elixir. Local doctors noticed the terrible pattern. Patients, having taken the medicine, were developing kidney failure, unable to urinate, their bodies poisoning themselves from within. The symptoms were agonizing. Victims suffered stoppage of urine, severe abdominal pain, nausea, convulsions, and slipped toward coma before death. For those who received larger doses, particularly children, death could come within days. It was a slow, painful way to die, and there was no treatment. A local medical society in Tulsa alerted the American Medical Association, which had received samples and confirmed the poison. The alarm reached the Food and Drug Administration, and what followed was one of the most extraordinary public health chases in American history. Hundreds of gallons of a lethal poison, disguised as medicine, had been shipped all across the country. It was sitting in pharmacies, in doctors' bags, and in family medicine cabinets. Every unaccounted-for bottle was a potential death, and the agency had to find all of it before it could be swallowed. The FDA of 1937 was small, and its legal powers were limited, but it mobilized nearly its entire field force, practically every inspector the agency had, and sent them out across the nation. It was painstaking, door-to-door detective work. Inspectors traced shipping records. They tracked down the salesman who had distributed it. They followed the chain from wholesaler to pharmacy, and then went hunting for the individual patients who had bought a bottle. In some cases, they went house to house. There is a documented account of an inspector finding that a physician's records were incomplete. He had to physically canvass a community to locate patients who might be holding a bottle of poison in their homes, unaware. Some of the stories from that hunt are extraordinary. Inspectors chased down bottles that had been carried to distant towns, sold to travelers, or passed between family members. A single missing bottle could mean a family spooning a dose of poison to a sick child. The pressure on those inspectors is hard to imagine, knowing that the speed of their search was quite literally a matter of life and death, and that every unaccounted-for prescription was a potential grave. They worked against the clock, against incomplete records, and against a public that mostly had no idea the comforting medicine in their cabinet was lethal. The agency also had to fight the manufacturer's own initial instinct to protect itself. When the company was first asked to send telegrams urgently recalling the product, early messages reportedly failed to convey that the elixir was deadly. The FDA insisted the warnings make the mortal danger explicit, so that no one would casually hold on to a bottle they thought was simply being recalled for a technicality. The stakes of that hunt are captured in one detail that is echoed through history. Investigators calculated that the amount of elixir distributed was enough to kill a huge number of people. The reason the toll was only just over 100 rather than many hundreds more is because of that frantic recovery effort. The inspectors physically got the poison out of people's hands. Their work, by any honest measure, saved a great many lives. In the end, agents managed to recover the vast majority of the distributed elixir, but not before it had done horrific damage. The final toll was more than 100 deaths, and the victims were, so often, the most heartbreaking imaginable: children given the sweet medicine by loving parents to treat minor infections. One letter, written by a grieving mother to President Franklin Roosevelt, has survived as a testament to the human cost. She described giving the medicine to her small daughter, and then watching helplessly as the child suffered and died, writing of the torture of watching her little girl's small body racked with pain, and of the sound of her dying screams still haunting her day and night. It strips away all the chemistry and leaves only the raw truth. A mother poisoned her own child unknowingly by trusting a medicine that had never been tested. There is a final, dark human note to this story. The chemist who had formulated the elixir, the man who chose the toxic solvent, reportedly took his own life as the scale of the catastrophe became clear before he could face trial. The owner of the company faced legal consequences, but here the limits of the law became starkly clear. The company was ultimately fined, but the charges that stuck were essentially about mislabeling. The product had been called an elixir, which technically implied it contained alcohol. In a bitter irony, the company was punished not for poisoning over 100 people, but for using the wrong word. Poisoning the public simply wasn't, under the existing law, much of a crime. And that is exactly what finally changed. The Elixir Sulfanilamide disaster caused national outrage, and it forced the passage of a landmark law. In 1938, the United States Congress passed the Federal Food, Drug and Cosmetic Act. For the first time, this law required that new drugs be proven safe before they could be marketed. Think about how staggering it is that this protection did not exist before. Until more than 100 people died from a raspberry-flavored poison, a company could sell you any medicine without testing it. The entire modern framework of drug safety was written in the aftermath of this disaster, paid for with those lives. It gave federal inspectors clearer authority and expanded oversight. It was a turning point that reshaped the relationship between the public, the companies, and the government. Nearly everything we now take for granted about the safety of medicine traces back to 1937. The legacy of Elixir Sulfanilamide is, in the end, the medicine cabinet you trust today. Every time you take a prescription and assume it's safe, you are relying on a system paid for in human lives. It should never have taken that. The knowledge that diethylene glycol was poison existed. The ability to test the elixir on animals existed. The only thing missing was any requirement to check. And into that gap, the gap between what was known and what anyone was required to do, 100 people fell. That is the enduring lesson of this case. The horror was not some exotic disease or unknowable mystery. The horror was ordinary negligence, made lethal by a system that asked no one to look before they sold. If documented cases like this one matter to you, please take a moment to subscribe to Dark Diagnosis Files. We investigate the real, recorded disasters at the edges of medicine. Your subscription is what keeps this channel going. This has been a real, documented historical event. New cases every Sunday, Tuesday, and Friday. Real, documented, told with gravity. The medicine tasted like raspberries. And the only thing anyone tested was whether it tasted good enough to swallow.